Hi, families. I just want to take a few minutes and update you on just kind of where things are at with COVID and just put some reminders out to you. So, a few highlights from the first few months. First of all, and I'll talk about all of these in a little more detail, but your communication with us has been really great. Symptoms by anyone in your home need to be considered a potential COVID exposure. Rules differ in preschool or childcare than they do in elementary schools or what you might encounter in other programs that your child is in. And then this year, classroom closures are a reality that we're dealing with. So, first of all, thank you so much for the way you've been communicating in a timely fashion with clarity by providing details. The more information that you can share, the better. Email is always the best because then I have all the details. However, I've been trying to provide my cell phone number to connect with me that way as well. And if you're emailing, if you can, as often as possible, if you're comfortable, include both your classroom teacher and myself, just so that we have that consistency in getting information to all of us. One of the things that we're encountering is realizing that there are no guarantees that there are no guarantees and that all symptoms should be taken seriously. Just outside of school, even, there's been lots of instances I've encountered and also situations that I'm certain your family has encountered where someone's tested positive, but they thought they only had a cold or only had allergies. And so just knowing what we know about COVID right now, and especially this Delta variant, we just know that unfortunately, you almost have to prove that you're negative. Otherwise, assume that you're positive until you know better. The symptoms that we're looking at in terms of what we're seeing individuals present with has been consistently inconsistent, and that makes it hard. Along the top of here, the red symptoms are still the more common symptoms. So a fever, even a low grade one. We've had some children who've tested positive and have a 99 point something temp, so not a high temp. The loss of taste and or smell, or the diminished notice of those senses. And then a cough, especially one that's new or changing or has gotten worse, those should individually be reasons that you get tested. The other ones, we're kind of looking for a combination, or when we're seeing kind of clusters of things. I think the hardest is a runny nose or nasal congestion. And so if families have contacted me about that as an only symptom, children are welcome to come to school as long as they can really just manage that runny nose. I think the other challenge in here is we know that kids get viruses. We know they get other things. We know that they're working on building up their immunity because they just haven't been around other kids as much. And so if what your child has is concerning and challenging to you, you might want to keep them home for an extra day just to see if those symptoms diminish a little bit, just so we're not passing these things on, even if they are just a virus, from child to child. Another big part of this is for those of you who are vaccinated. I think that when we have that vaccine, we want to say that we should hopefully not get COVID. And I absolutely understand that. And the number of breakthrough cases is low, but it's still happening. And so if an individual at your home develops symptoms, whether they're vaccinated or unvaccinated, please take all symptoms seriously until you know for sure. And testing is also something that is important. It's become so much easier. Just going to share a few things with you. So GS Lab testing does a nasal swab. If they're doing the rapid test, it's not nearly as invasive. So rapid tests are typically those initial ones to determine if you have COVID. With GS Labs, families are getting results back within an hour. If you have a child who can handle like a saliva test online through the Minnesota Department of Health, you can order free saliva test kits, and they're Zoom administered. There's also many other free testing sites that you can go in, be tested. The downfall there is that saliva needs to be sent in to be tested. The upside is it can also be a PCR test, so it's another way to do it. I just want to talk briefly about the at-home over-the-counter tests. This is what I have learned about those from reading on what Minnesota Department of Health has to say, but also just from our health nurses that work with our program. So if you do an at-home over-the-counter test, like you would buy at Walgreens or Walmart, if it's positive, it's considered positive. If it's negative, and there are still other symptoms, you still need to do a lab-confirmed test to assure that it's negative. So just something to keep in mind as you consider those as testing options. One of the things that I absolutely understand is it's very confusing and also very frustrating when there are different rules for different schools. I know some of you have commented about, for instance, District 833, and that if there's a positive case in a classroom, the entire classroom is not closing down. Last year, when we were in a peacetime emergency, everyone was playing by the same rules. Now there are different rules, and some of what is in place is that childcare programs like ours are required to follow the decision tree. It's what we've been using since fall of 2020. There's a few changes that have happened, but largely it stayed the same. And so this is, you really can't read it, I know that, but this is what we're using. So if you have questions, you can always search for Minnesota Department of Health decision tree. When you contact me, this is what I reference if I'm not sure how to answer your question. And I know that when you contact me about your child being sick and I say they need to be tested before they come back to school, I'm doing my very best to align with the guidance off of this so that I can be as consistent as possible for you. I know that this year is so much harder. All of us, families, kids are just doing more. Kids are in sports, parents are back at work. Families are out and about and engaged in doing things with other families. There's so many different opinions about protocols. I know that this can be especially true with elementary schools. Some families are following recommendations and keeping children home. Some families are simply overwhelmed by recommendations and just keep sending their child unless they develop symptoms. That's tricky. And that's part of what makes this hard. We know the Delta variant and asymptomatic cases are affecting children more. COVID fatigue is real. That's all I have to say. It's taking its toll on all of us in different ways. And class closures are just way more common. This year we are on classroom closure number 4. And that breaks my heart because I know that you're paying tuition money to have your children in school, not to have them at home. Last year, we had one closure near the end of the year. A lot of it is just some of these things that I've just talked about on this slide, but some of our closures possibly could have been prevented by everyone really following the rules. And so if you're in doubt, contact me. If you're questioning whether your child should come to school, contact me. If you're just not sure, get a test. Your child can come to school a little bit late that day. We want to do everything we can to have kids in school and to work with you. I just want to share this. So this is also the reality that we're facing. Every week, the Minnesota Department of Health puts out kind of an overview of just the COVID situation. And these are cases relating to childcare settings. we are in that highest, most consistent range of seeing COVID positive cases. And I think that also holds true for schools, for elementary schools. So it's not just us, it is across the board. And just a reality of the world that we're in right now. So things that I want you to know is I am absolutely committed to continuing to do the very best that we can. I want to be as consistent as possible with each situation, with how families are contacting me. I want to do the best that I can not to create a situation where it seems like what I did in one instance isn't staying the same in another situation. I want to be transparent with you. That's part of why I'm sending this out. Part of why I want you to know that there have been room closures. It's not something we like, but it's a reality. And I want to be able to continue to communicate transparently with all families. I really want to reduce the time that children have out of classrooms. That's why when we are doing a classroom closure, we're offering a 7-day quarantine. But I want you to know, so that you're not surprised, if your child is the one who tests positive, they will likely be out of school for at least 10 days. If someone at your house tests positive and they can't be, and you can't separate your child from that positive person, they could be out up to 24 days. And that is an eternity. And it is heartbreaking for me to share that news or to send it in an email. But that's just what we're being asked to do. One of the things that's hard is with the decision tree and the rules that are in place for childcare is they're also linking it to funding. And so if we don't follow the rules, some of the state funding that we receive for scholarships and that kind of thing can be pulled away. We want to provide opportunities for out-of-school materials. So if your child misses, how can we provide them with some materials that let them practice skills that they would be working on in the classroom and yet don't overwhelm you as a parent? Each day I want to provide high quality staffing. Much of our subbing happens within our program. And so it may be a different teacher, but someone very familiar with our program and how we do things. We know that staff get sick too. And so we have those same rules in place for them that we do for children and families. And so that kind of leads into that last one, that consistent health practices. So one of the things, in addition to consistent enforcement, is staff are doing biweekly COVID testing, just to be sure that no one is testing asymptomatic. They have the same rules. They check in each morning and do temp checks. We're doing the best we can as a staff. We also continue to do lots of cleaning practices. We wear masks in common areas. We want to support children whose families want them to wear masks in the classroom. We want to do all those things to try and make things as healthy as we can, so that all of us can be in school. And so I want to thank you. I know that this is hard. I want to thank you for taking the few minutes to watch this and to know the information. I want to thank you for checking in when situations come up at your house. I want you to know that I appreciate it when you get tested or you have your child tested and you share those results. I know it's a lot. And I'm proud of the work that each of your families is doing to make this a healthy and safe place. We can do this. We can work together to care for each other and to keep our kids in school. And I just want you to know how much I value that partnership. If you ever have questions, things that you're wondering about this presentation, or just things that come up with your family, know that I'm always available. Thank you.